Hi, it's Patrick Hutzel from IntensiveCareHotline.com with another quick tip for families in intensive care. So in today's tip I want to talk about another success story. So we're currently working with a client who has their 91-year-old mother in ICU. She's got, initially she had a hemicolectomy, she had some bowel resections after she had a bowel obstruction. And then she ended up with pneumonia in intensive care, and she has now been ventilated for about 2 weeks. Now, bear in mind, this lady is 91 years of age, but previously has been fit and healthy. So last week we had a family meeting with the palliative care team and with the intensive care team, and the lady was still in an induced coma, was ventilated with a breathing tube, and the intensive care team was pushing towards end of life and said that she will never wake up and that she will not even survive 48 hours of their stay in intensive care. So we objected to that because, the biggest challenge for families in intensive care is simply that they don't know what they don't know. So what do I mean by that? Families in intensive care don't know that 90% of intensive care patients approximately survive. So one of the first questions you as a family in intensive care need to ask, why would your loved one not survive if the odds are in their favor? And we then questions, rather than doing a quote-unquote one-way extubation while still on sedation and basically letting their loved one die because they're still on sedation and then they wouldn't wake up and possibly suffocate, we were opting for a tracheostomy for that particular lady. And the intensive care team reluctantly agreed to that, and not even 1 week later, she's now slowly waking up. Now, she still hasn't got the tracheostomy, but the reality is this lady is waking up and she's doing purposeful movements. She even went as far as removing her breathing tube on purpose. Now, she's not ready to be extubated yet, but those are good signs. So the bottom line here is this: you got to question everything in intensive care. As I said, the biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's where we can help you with here at IntensiveCareHotline.com. Here's the moral of the story. As I said, you got to question everything. You got to question the motives of the intensive care team. Now, intensive care resources are in short supply, whether it's staff, whether it's equipment, whether it's beds, especially with COVID still running rampant. So by extubating someone and providing end-of-life care, which is a euphemism for letting someone die, they're freeing up a bed. Their biggest problem is solved. Now, by having someone having a tracheostomy and potentially a PEG tube, they could stay in intensive care for long periods of time, and that is the intensive care team's worst case scenario. Their worst case scenario is looking after someone indefinitely with an uncertain outcome, and this lady potentially fits the criteria. But again, on the positive note, she also had now some spontaneous breathing trials where she was breathing on CPAP or some pressure support for a few hours. That's a great start. So, going from, she's not even going to survive 48 hours, now 1 week later having breathing trials, waking up, making eye contact, obeying commands such as squeezing fingers, poking out tongues, wiggling toes. There's a big difference there. And now this lady can actually make up her own mind what she wants. Does she want to die? Does she want a tracheostomy? Does she want to do more breathing trials? Now this lady is in a position where she can make up her own mind. She doesn't need other people to make decisions for her. And the intensive care team's job is to provide best care and treatment and making sure this lady is in a position to make up her own mind despite her age. It's not a matter of age, it's a matter of personal choice. That is my quick tip for today. Now, if you have a loved one in intensive care, go and check out IntensiveCareHotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@IntensiveCareHotline.com. Also, like this video, comment below what you want to see next or what insights you have, or insights or questions you have from this video. Click the notification bell and subscribe to my YouTube channel. This is Patrick Hutzel from intensivecareoutline.com, and I'll talk to you in a few days.